Really cover all bases when you're interacting with first-time clients. I mean, naturally, especially clients that have not had massage before, but you want to be really clear with like what sheet they're going underneath, and then we should be walking in with them underneath that top sheet. Without bolstering, maybe they're laying on that pillow for their low back, but that would be the only bolster you usually have. I do not suggest leaving the ankle bolster on the table to start. We're gonna walk in, and then the very first thing you wanna be doing is getting that bolster underneath her ankles. Now, people are usually pretty happy to help, where you can just reach underneath, finding that second sheath, and then asking, hey, can you lift your ankles? A passive way to accomplish this is to take both flat sheets and use them like a harness to just lift their feet.
I think that's kind of passive aggressive.
I almost always combine the action with, there's a little bit of a verbal cue, like we're gonna lift your feet. I try not to surprise people, so it's gonna be like we're gonna lift your feet up. They'll usually help a little bit. I do not do this very often. This would be in the case that maybe there's some paralysis, okay? Where a person needs the assistance for the movement, okay? You can use the sheet. You could even use the fitted sheet, just wrap it around and use that to lift their legs.
So you'll do a tactile cue and a verbal cue?
Yes, yeah.
Okay.
I almost always, usually what it is, I come in, touch an ankle, and usually the contact is like, all right, we're just gonna get the bolster underneath the sheet, lift, and there's a little bit of a prompt underneath, and that's typically the case where like they lift their feet and then I can bolster.
Even if I'm trying to be quiet, I'll use my hand to kind of prop their feet, and it kind of gives them the cue to lift up, and I can shove it real quick.
Almost always that's gonna be the way to go. And then we have them set, but always, okay? Just, that's your very first thing. You're coming in, confirming they're underneath the sheet. You know,
Half of that.
you're knocking on the door, you're making sure everything's set, but when you come in, your very first action is bolstering. All right? You gotta make sure this is here. And there is no reason that I can think of in almost any situation not to bolster here. It protects the feet, it puts those knees out of end range extension. So it's a protective thing. Both joints are now in a loose, packed position where you are not going to massage and inadvertently take them to end range. So bolster every time. Okay. To confirm where the placement is, just make contact with their heels. They have calcaneuses. And that should be pretty much right down the middle of the bolster. The other aspect of this should be that the tops of their feet are actually making contact with the bolster. That way, if I massage the foot, their toes aren't going to get jammed down into the tape. And that's not a hard adjustment, even if I have to do on one side. If it's too high, and they're like this, then I just go, well, that's not right, and I just scoot it down, right underneath. We get that place nice and good. So first thing, bolstering there. Now we can sprinkle in some chakra balancing. We can just hold the ankles. In the anatomy of this stuff, and I believe in everything and nothing all at once, so, you know, live in my absurdist reality. That's great. But chakras do exist kind of as joint structures.
It looks like you're holding the heels, but it's probably just the skeleton, so is it the ankle?
No, I'm at the heels. I am on the calcaneus. So this will be why I have
Okay.
the skeleton here, is I want to confirm a little bit. See? Where you have that
That's what I thought.
crazy cool
Same.
projection.
So I
This
was like-
big, giant, monstrous bone. Look at that thing. The biggest tarsal bone by a lot, right? So that's what we're making contact with. So this is going to be a little bit of like, we're doing draping, we're doing our pattern, but also we're going to start identifying the beginnings of the human's anatomy. Well, when you're making contact here, it feels nice. But what you're really feeling in terms of the skeleton are the calcaneuses, which we call the heels, but that's the biggest tarsal bone. We'll go through the other ones, but calcaneuses. And then I could confirm, if I move up, what you'll be feeling now is more like their Achilles tendons. That's close to their ankles. Okay, then we work our way up. Now you're gonna be working over sheet, but occasionally I'm gonna drape, undrape in such a way so you can see. But let's go ahead and palpate just the knee joint. We go from the calcaneuses, ankle joint, knee joints. We will be a little bit modest and cautious around the pelvis and hips. So here, let's go to more, not like here on the outside of their hips, but to their sacrum. What we're looking for here to palpate is right down the middle. You want to be trying to find where there'll be a swoop up, and if you were to go either side, the gluteal muscles on either side, but like right down that middle, there should be kind of just a hard shelf. That's where you're finding yourself the sacrum. And now we're at the beginnings of the axial skeleton, which is going to be the structures that make up the spine, the ribs, and the skull. So there's two divisions of the skeleton. Axial, which is what I just listed, sacrum, spine, ribs, cervical, skull. Everything else is your appendages. So appendicular. Appendages, appendicular skeleton. That includes the elephant ears. So pelvis, limb, lower limb, scapulas, upper limb. Clavicles included. Part of the appendage idea of the skeleton. All right, sacrum. On either side, we have the ilium. This won't be something with a palm-based application. Would be what you would want to do a lot of work on. Open palm on the glutes and the hip area. It's not wrong, but with your first-time clients, we have to make sure we're pretty modest here, right? So palm application here, and not with my fingers down, like I'm keeping where I lift my hand up and my fingers up in such a way where I'm using the lower part of my palm, like a bit of a wedge. Now we're to the lumbar spine. Now, one hand on the lumbar spine, one hand on the thoracic spine. One hand on the thoracic spine, one hand on the cervical spine. And we could go up and even make contact with the skull. Be surprised at how soothing just placements around the skull can be. Here, walking all the way around, navigating around the table and just making contact with these areas, right? Now, once we're here at the head of the table, let's make contact with the scapulas. And all of this can be done even when we have people unclothed over the sheet. This will all be like this initial contact phase. Now we can find the scapulas. Now these scapulas have been bolted down, so they don't have any movement. This would be not a good sign. If I can just get my hand set in such a way where I can find that lower angle, if somebody has a winged scapula, you'll really be able to feel that point, that lower point. That's the inferior angle. If you can just get your middle fingers making contact with those. If you bring your hand straight down, your palm should be coming in contact with a bony ridge somewhere, where you can kind of identify that. And that's called the spine of the scapula. And it's okay if you can't find it right now. And you're hearing it, we're trying to do some compare and contrast. If you can even find this edge, medial border with your thumbs, and you just rest your hands down so it feels like you have your hand on the same parts of either scapula. And then just look at your hands. Are they exactly the same, or are they a little bit crooked?
A little crooked.
Yep, everybody's gonna be crooked. Everybody's going to be crooked. This doesn't work all the time, but typically their dominant arm, that scapula, will be up a little bit.
Are you left or right?
Are you left-handed?
You're right-handed.
Mm-hmm.
So usually the dominant arm, the scapula, will be elevated slightly. Cool. Now that can be just how we start. What this ends up looking like is I walk in, make sure I got the bolster place, and I very soothingly make contact, little rocking, because it's resting position, but that's a bit boring. So I tend to combine resting with a little bit of rocking. So here, here, come up, I find the sacrum, and here's where that part I was talking about, making sure the low back can move okay. If I can get my palm, lower part of my palm, right on the sacrum, and just try to rock the pelvis back and forth a little bit. And it's not very delicate, like I gotta try to give them a good nudge in a direction. And nobody looks like they're too broken. But if they moved like the skeleton, where I felt my hand on their ribs move with them, that would be a sign that something is really tight up and down the spine. We'll get to where even confirming the pliability of the ribs, like feeling their low back and their ribs, just kind of between their scapulas and your hand resting right on the lumbar spine. Everybody take, your clients, or everybody, take a nice deep breath. All the way in, all the way out. Which hand moved more?
Upper one.
Upper one?
Lower.
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 Good. Well, hey.
Good mix.
Usually you want the
Breathing.
lower hand to move more. So we would indicate that the diaphragm is functioning more for belly breathing. If the low back moved more, if the ribs moved more, then maybe they have a tendency towards a little bit of upper chest breathing, which we're all prone to. But even that could be an assessment. I just rest my hands, they take a nice deep breath. I feel that their ribs move more or their low back move more. It's more than that that's moving, but there you go. And then we come up, and the same thing with the scapulas. We already identified that, where we can confirm the asymmetry. And then we're off to the races. A cool thing for remembering the numbers of vertebrae is if I were to use a dial clock. I know that they're a dinosaur. People can't tell time on a clock dial anymore with the hands. But if you can visualize that, it will help you in this. We create a triangle, and I don't eat like this, but 7 o'clock would be breakfast time, noon is lunchtime, 5 o'clock is dinner time. I lived a farmer's life. Okay, you see that cool triangle? All right, 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae. Breakfast, lunch, dinner.
That's right. 7, 12, 5.
7, 12, 5, triangle on the clock. Say, the cervical spine and the lumbar spine are the most mobile. The thoracic spine has ribs on either side. So can you guess how many ribs you have?
12.
On either side. Cool. So the rib count there, 7 cervical, 7 main chakras, 7 true ribs that come and make direct contact with the sternum. They wrap all the way around. So 7 and 7. Then we have to make up the difference with 5 more to get to the 12 on either side. There's 3 faults and 2 floaters. The ones we have to be a bit more aware of are the 2 floaters. All right, we don't want to be matching on those too much. The ribs, especially related to breathing, when we inhale, the ribs come outward. When we exhale, they go downward. Most people need help with the ribs going downward. Even chiropractic adjustments, most of the force that's occurring is going to be related to like getting that facet joint to go down a bit. That's going to be why when we're here, your applications are going to be predominantly, my suggestion is to apply forces on the ribs in such a way where you're pushing them downward. That way, I can't inadvertently come up into the sharp elements of the floaters, just from an ouchie perspective. But also when we start working more just in terms of ways that are more efficient for me biomechanics wise, but then also maybe have added value to them therapeutically. If I apply forces this way, I'm assisting moving the ribs into an exhalated state, which should help with better breathing. So if I keep my forces predominantly moving the ribs down towards the pelvis, see these two actions this way, with my right forearm if I'm on their left side, and then I switch and use my left forearm here between the scapula and the spine. Both of those applications, the force is going to be pushing him down, right? But they're also good for you biomechanics wise. Now it's not wrong to go up. It won't blow up, but it saves you a little bit of hitting the lower ribs, because in this area that can be problematic, and it'll help you with also not hitting the scapula, because going upward like this is where we talked a bit about that, where sometimes therapists will hit the inferior angle of the scapula and then kind of roll over that, and it doesn't feel good and it's not really doing anything. So you can save yourself all of that if you just don't go that direction to start. Okay. Word salad, blah, blah, blah. Let's do a little bit of a reset. We walked in, we got the bolster in, making contact, and notice now we're officially off and away. Knees, low back, sacrum, low back, lumbar spine, thoracic spine, cervical spine, skull, scapulas. Nice way to make an introduction to the body. You can develop your own as things go on, but you should have some kind of system of resting plus rocking where you make contact over the sheet before you drape. And I suggest making contact with the area you're about to massage over the drape and then drape the area. So I'm going to be relying on the bunch. There's tuck methods. There's more of a contour like lasso method. There's inadvertent contact. There's more inadvertent contact potential with those. So I'm a bigger fan of just the bunch. So if you really want to do it another way, I have no territory where my ego is invested in this, but it's my suggestion of what's best. All right, now we're here. We're making contact. The next thing is if we're going to work in the low back area, we can get that arm out of the way to make it easier for us. Okay? So if I bring the arm out underneath the sheet, now I can also just undrape, find their hand and their wrist, and bring that out to the side. Confirm that that's comfortable for them. Arm out to the side like that.
Everyone on the table, put your arms up. So
Out to the sides. And I want the therapist to actually do the movement. So stick their arms down on the sides of the table. And grab near their wrist, because it's going to be like anything. By moving the arm, I want to try to support their joints to assist this action. So hold near the wrist, hold near the elbow.
You don't need to put down the side you're working on, obviously.
Yeah. Yep. You don't have to put down both sides. I put down this side, confirm that's comfortable. And then over here, all I have to really do is support the elbow to bring it up and see if they're comfortable bringing it up over their head. In a clinical space, what would be a bit more comfy, well, I put it up there, is I had said with like the hydraulic stool, where they could be resting their hands, or those shelves that can sit on your face cradles. They could just rest their hands like that. That prompts and makes it really nice. That's where I end up accepting that those shelves can have benefit. I'm a bigger fan of using the hydraulic stool than just rest their hands there. Now, you've confirmed that their shoulders and their scapulas have mobility by doing this, right? This was shoulder abduction. Then we're going past 90 degrees. And now we're thinking about scapular movements. So it's a good little assessment thing. But from an efficiency standpoint, now I can get close to the table, not make inadvertent contact on their arm while I'm working on their low back. If they have to leave their arm there, then you're going to have to just figure that out. But it's going to be a little bit of an adaptation. Your biomechanics are always going to be better when you're not reaching. You gotta let yourself get close to the table and stay more upright. Here's my body mechanics on this side. We move the arm. I'm standing right up to the table. I'm on an angle. I'm not like this. I'm on a bit of an angle. So you see how I'm standing closer to their shoulder so that I have somewhere to go as I lean forward towards their low back. There's their low back. And I just bring my forearm and then slowly sink in. We talked last week about, you can change your elbow angle a little bit. If we increase our elbow angle, we're going to be more on the lateral side of the body. If I decrease my elbow angle, I'm going to be more on the posterior side of the body. So I can kind of just not fully break contact, increase my elbow angle, sink in. Come back out, decrease my elbow angle, set it, and kind of have to set it once you determine what your contact's going to be, and then sink in. Now here what you would see is that like when I increase my angle, my elbow starts making contact with the pillow. So I'm going to be more on the lateral side of the low back. I come back, and I'm here. Now I didn't touch the pillow, right?
Okay.
Sorry.
You like more or the same?
How's that pressure? No, it's
Good.
And everybody did a great job just now. So the next part is, let's see if you can confirm your pressure levels. So make sure you're not bashing into the top of the pelvis. Moving in this direction, you should not be able to hit the ribs even if you were really trying hard to. And even if you do go over them, it's not going to put them on stress. So as you sink in, get yourself set where don't try to make a glide out of this, right? You're applying a force and then you're just sinking in, but you don't want to be slipping on the clothing right now. You're trying to determine how much pressure is ideal without any slip.
Yeah, that's good.
Make sure you're pretty far down, closer to the low back. Yeah. And then yeah, you should just feel like you could lean into this and hold it for a while and just hang out. Now, don't pay attention too much here. That's good body mechanics. And your right arm stands good. And then just see, make sure you're comfortable. Sometimes I've had to make sure that I get my pelvis and my sternum lined up appropriately because I don't want to be like this, right? I have to make sure that I get my sternum lined up so that my body weight's falling forward appropriately. All right. And those two applications, you can do pretty rhythmically. You'd be amazed at how good you can kind of just make this feel. And if I take a step more towards their head, it's going to be pretty close to the same contact, but I'm going to be trying to avoid those ribs. I don't need to be mashing on the lateral side of the ribs too much. So we're going to stick a bit more. Not a big elbow angle, pretty flat, but you should feel like you're up on the ribs. That's a small. Look at the distance I actually covered here. Even on this skeleton, this is a small skeleton. This would be a shorter person. That's the window that I need to cover. So I don't need to make this big. 1, 2. 1, 2. Then I swoop around. Now we're here at the mid-back. We can get the arm now out of our way again by just moving it off to the side. This orientation puts the scapula in the best place for you. Here the scapula will be rotated in such a way where this area that people want will be smaller and harder to work on. If you have the arm here, it's okay-ish, but it tends to wing it out and makes it harder to work on. This is the best place for if you're working in this upper shoulder, upper trap, or between the scapula and ribs. So you want the arm out here, ideally. I put one hand just resting on their upper arm, and then the other arm, which will be my working, very good, will just plop right there between the scapulas. between the scapula and the spine. And you can step closer, where it would be like you're right beside their head. Like your hip should be right at their, kind of at their ear. If you step a little bit closer, you can work lower. So I can get lower on the ribs. There you go. Now this one I tend to start high. I tend to step further away where I'm not even like touching the table. Increase my elbow angle so that I'm more on that upper trap, that spot everybody wants you to work on. See how like I'm lifted here? And I step a little bit closer. Sink in. Everybody wants pressure there. It's a good spot. Then step a little bit closer, flatten your arm out, and it should feel like you're just had your whole forearm right between their scapulas and their spine. Give it a good squish, and everybody take a nice deep breath. Hold your compression. Feel those ribs under you. And then a little step further. Let's get nice and close. One step down. Hold the compression. Good deep breaths by your clients. When you're on the ribs, that's a great thing to incorporate. And for you to feel, you know, you hold your compression, you have them do a movement, in this case, breathing. All right. Now, we were already touching this area, but best practice is once you're done massaging an area, re-drape it. And then we're here to the upper arm. Let me come around to the other one so you can actually see me. Now this is where we can start distinguishing. It's harder to palpate the humerus. That's why funny bone is humerus. Thank you. Done. What initially is easiest to palpate here is if we're like this, because we were just here, if I mirrored myself. This is how I was working, holding here. If I just stand up and use my palms and I come over to where I'm feeling kind of what we would perceive as the top of their shoulder, you should find this bony plateau. Okay? If I follow the spine of the scapula out, it turns into this bony shelf. And the name for that bony projection is called the acromion. And you can find that on everybody. It doesn't matter how muscle built they are, right? You can always find that. Then I know if I just go a little further out from there, that's where the ball and socket joint of the shoulder is. So if I hold here, and if I just nudge the arm, I don't have any soft tissue on this, but if I just give this a little bit of a compression, see what that does to the shoulder? Causes a little rotation. You should feel a little bit of a twist under your one hand as you do that. So this would be when I push the arm this way, or if we stop for a moment and just grab near the wrist, because we want to be grabbing at the distal ends of the bone so that we have an easier time lifting. This is about just efficiency and leverage. So like if I grab near the wrist, I can do this motion.
It's okay though.
Don't ever go through a range, and then range like this would be a lot. That's too much. Most people will be limited to about here. Just right where it stops, and that's all you need to identify. It stops, and hopefully there's no screaming. And then stop. And then there's the other way. This way will feel easier. So that's internal rotation, external rotation of the shoulder joint. The elbow was already flexed, but internal rotation, external rotation. When I do forces like this, I can be causing small rotations, not end range. But if I just massage, just rhythmic compressions on this side of the arm, it'll cause just little. These do not have to be big. Like it can be just this. If you see how that humerus, the head of the humerus is just rolling back and forth a little bit. When people have a bad arthritic shoulder, this is one of the best things I can tell you to do for them. You don't want to take the arthritic shoulder to full end range. We want to give a little bit of a wiggle to keep that synovial fluid going. So this might look really simple, But this could be an example of what I would tell you to do for somebody with shoulder issues, to make sure that you're applying forces that cause these tiny rotations. And that's the best angle for you. Now here, we come around, so now we're lined right up with the humerus. This is where you get cool x-ray vision, right? There you have the soft tissue. There's exactly what's underneath all of it, right? So we're lined up with it, we can support the elbow. You know, I have the table in the way to assess the elbow fully. I could take it to extension at least. Take the elbow to extension, flexion, flexion, extension, flexion. Supporting the elbow, and there's a couple options here for supporting the elbow. I could hold it like this. I'm lazier. And then, when we are able to glide, this will be easier. If the scrub top is such where you can kind of nudge the sleeve out of the way. Now, we're not gonna have lotion, so it's not gonna be a true glide, but palm usually here is a little bit uncomfortable for me. I'm a bit more comfortable like this. And I'm sorry, let me put my hands. This is a better setup because it keeps their arm from slipping over the edge. So the hand towards their head should be the one supporting. And then you could use a forearm. Step closer to the shoulder, step away, closer to the elbow. Closer to the shoulder, closer to the elbow. Then we reposition. There goes the elbow into extension. And then here's that crazy forearm. When people are laying down, they're usually going to have their thumb towards the inside. They're going to be pronated. Okay? But watch that radius. Now this would be anatomical position. Supinated right now, okay? So watch that right here. See how that spins? So this moves. That's what you see move, but the movement's actually occurring here, closer to the elbow, at the radius. The radius is smaller and spins near the elbow. It's the biggest bone at your wrist.
Is that why tennis elbow?
Tennis elbow and golfer's elbow. Tennis elbow has a backswing. So they're going into a supinated state. Golfers, a pronated state. So tennis elbow is an
Mine is
extensor pattern
For
thing.
being this,
Mm-hmm.
mine gets it real bad out here, so if I grip here, it's out here.
Lateral epicondylitis, because the tendons of muscles that overlap, they're not specific to that action. There's one deeper, but right here. So you have a long bone, you have a long bone. These are ball and socket joints, so there's a head and a head. There's a different thing here called a trochanter. Here it's called a tubercle. Then here, you know when we draw a bone like for Halloween, those big roundy bits we put on the ends? Those are condyles and epicondyles. Condyle, epicondyle. The epicondyle is usually what you're actually palpating. So epi above, but the condyle is like the rounded bevel. You have less of that than here. The femur is what people are usually drawing when they create the comic book or bone. So lateral epicondylitis is the clinical term for tennis elbow. Medial epicondylitis is the clinical term for golfer's elbow, because the tendons go onto the lateral epicondyle or the medial epicondyle. And those are the ones that get irritated relative to the action. There you go. Now, a person's laying here like this. I could confirm by just turning their hand over if they can supinate or not. My draping is terrible. So they are pronated.
Okay, I didn't know that right there.
and they are supinated. Now, usually when I do this, their hand will rest kind of on the outer edge of the table. But then we confirm, is that comfortable? Is everybody comfortable if we turn your hands into supinated? This is anatomical position, or at least closer to it.
Be comfortable.
So right now,
Yeah.
this is the
That's more
posterior.
It's gonna fall arm.
Yeah, you have to hold it. This would be a case where it's always like having to support, yep.
This is my
Yeah, they'll
working
just-
arm, so this arm, my shoulder's so tight.
Okay.
So there'll be a lot of
I was
that,
gonna
where
say,
one
like
hand
this.
is supporting
I was
the
like,
body and stabilizing it, while the other hand is doing the massage.
Okay.
Okay? Now here will be where most people are comfortable, but if it's tight and restricted, then it can be two things. Sometimes doing this ends up causing stress in the shoulder joint. So if that's the case, we don't do that, then that's not for you. Right? We have to limit that, and I'm like, okay, I'm not gonna be able to do that with this client. But that tells me something for future analysis.
You said I'm limited in that way, this one?
Would we get a
Internal
little bit of a,
experimentation,
Makes sense, I spent all day doing this.
yeah. I mean, it's
here
not
in that
firm or
anatomical
anything, it's
position,
just-
because it's exposed differently?
Upset.
What's
It's not
worse,
hard,
honestly,
it's
is
just
if the
a
edge of the
little
table is sharp.
Just-
Oh.
But yeah,
Oh.
usually it's not, yeah, because with the drape materials, we're just making contact with sheets and stuff, so, yeah, no, you're usually okay. Areas to be cautious of though, to be clear, that
Massage.
medial portion of the upper arm, we talked about that, we're not gonna be working here too much. And then the concave or sides of the elbow and the knee, these are pretty sensitive areas, the skin is sensitive, there's also vessels, and there's a passageway, so we're not gonna be mashing around here, we're not gonna be mashing around behind the knee, until you really, really, really know what you're doing. Now, here though, at the form is gonna be a great place to begin going into our new fancy massage technique, which is going to, the compressions will turn into glides, right? If I just have some lotion here, and I apply compression, and kind of just give it a little bit more force, not straight down, but across, and wait, the glide will happen. Over clothing, we don't want that. It's not good for your skin or for theirs to force a glide over clothing or over the sheet. So when you're over cloth, you have to think this rhythmic compression technique that we're learning right now. You would use that in a floor-based like Thai massage routine. It would be rhythmic compression, but not forcing a glide over the material. Once we're to skin though, we will then, in 2 weeks time, we come around, was it 3? Maybe 3 weeks time, geez. Be playing around with applying lotion and getting used to that as a dynamic. Working on skin though, you'll be surprised. We don't have to be forcing, the theme is always gonna be slow things down, all right? So with my marshmallows. There they are. My favorite new anatomical models. It's amazing what, since you're in this world, the analogies to start building out of this. So if I were to just flip this upside down, what we can have as a very general analogy for the layers of soft tissue. The graham cracker is supposed to be a s'mores. It's also supposed to smell like s'mores. Okay. I don't know if I agree with that. Graham cracker would be the skin, which is layers of skin, epidermis, dermis. The chocolate would be superficial fascia. Just under the skin, you have a layer of specialized fascia. Has anybody heard of myofascial release or connective tissue work? Okay, that's usually what's predominantly being worked on there. Superficial fascia is very elastic and pliable. That's why I can take the skin and move it in every direction. It's not that the skin is particularly mobile. It has the ability to stretch and stuff, but it's the superficial fascia underneath that it's connected to, right? It's like here I can lift my skin and I can move it back and forth. The skin is pinched and the superficial fascia is being what's mostly being stressed. Like anything, I don't want to ever feel like for a client we're pinching skin. Should have like that kind of stretchy, burny sensation that's satisfying. The marshmallow. We have to imagine that the marshmallow is encased in cellophane. some kind of plastic. So visualizing that plastic wrapper around this white part, that would be what's called deep fascia. So it goes skin, superficial fascia, deep fascia, and then inside of the deep fascia is the happy marshmallow, or the upside down marshmallow. That would be your muscle tissue. And then you go down and the layers continue. You only have superficial fascia under the skin. After that would be another layer of deep fascia, another muscle, and then eventually you're to a bone in between the two. Some areas there's multiple layers of these stacked on top of each other. Sometimes there's only one or two. That's kind of what I'm visualizing. Now if I have this plus a bony structure, and I'll just use the actual bony structure. What we can be thinking about is, am I compressing all of this soft tissue stuff directly into the skeleton? That's going to have a different kind of sensation. It's going to stress that soft tissue differently. Then, if I push it to the side, so is it getting squashed right straight down into it? Or am I bending it and pushing it this way? It'll still feel like there's a force, but it's not, but it's a different direction, and it's stressing the tissue in a different way. Compressions and glides tend to predominantly be that, going more into the skeleton. But then we get to, if I change the direction, I get more lateral, sure there's stuff like this, but kneading. In order to do a knead, we need to be able to do a compression or a push plus a pull. It's still a compression. That doesn't change. The other hand is on the other side, holds the area still. At least that's the way I tend to do it. I tend to get my hands set. They're not like this. They're not like this. I like that. There's space, and then they need to have even more space. I make my shoulders a little bit exaggerated crooked, then sloth claw. Ah. Yeah, I could grab on, my hand wouldn't just give way. Kind of all fingers together, all flexed together, holding, and then acting as a nice rounded pulley. Hook, I should say. Now I can join that with the push hand. My push hand is the leg that I have forward. That never changes. It's still a compression with your push hand. We're just adding sloth claw. And you can do it a variety of ways. It can be, I tend to pre-pull and then push. Keep your elbows straight. It can be a push-pull, but the goal is this torsion effect. I tend to get my hands placed, just make sure they're pretty separated. The limbs, why we're talking about this now, the limbs are easier to knead than the torso. Push, pull. The way that this tends to actually go is I pull a little bit towards me, I get a little bit crooked, and then when I sink in, see how my shoulders lined up? And this becomes the knead. I'm doing all the same, push with my left, push, pulling with my right. Push with left, pull with right. Then I can switch, push with right, pull with left. Push with right, pull with left. But we can really slow this down and just think about creating a sandwich. One hand on one side of the limb, one hand on the other side, and then squish them together. The twist will happen on its own. You just want to feel like you're not on bone. The forearm's in this position, closer to the elbow. I tend to use my push hand on the forearm muscles closer to the elbow. My pull hand will be closer to the wrist. Push, pull. Push, pull. And then I can work my way down the forearm, like that. And hold it. What's nice about the forearm in particular is you can get your hand like all the way over. You can really wring the sponge, but don't twist like that. You want it to feel much more like you're creating the sandwich effect. And then that torsion will happen. You don't want to be too slippery right now to start. You would add lotion to cause the need. And then I just switch my hands. Now I can do a push hand, be more cautious by the wrist. And there you go. Now there's that. Now we're gonna have to make sure I tell myself I'm always clipping on them faster and then I get lost. So we'll try. Here, my suggestion to start is soft fist for the palm. There's other options here where you use, but I want you to just really learn ways to limit your hand usage to start. One thing I protect is their thumb. So this hand, in this case I'm on their right arm, I'm using my left fist for compression. My right hand is coming over and supporting the thumb joint. Kind of gathering their palm into the fist. You should feel like they're kind of making their palm hug the fist a little bit. That way when I push their thumb, it's just not getting cranked. And I'm just getting a nice hand hug, right? That hand is on the other side. See how this is very similar to a kneed action? I'm supporting one part of the body while compressing at the same time. And you just kind of do that rather than twisting here, which is what people want to do a lot. Just kind of take small steps. Sink in, I was doing like a few steps all over the place. Letting that change how the orientation is set in their palm. It works pretty good. Okay, reset their arm wherever is comfortable.
Where do you want to put it?
You do that every day.
All right.
My thumb, that was so good.
Oh, really?
I have so much pain in my thumb here from spinning my sticks.
So was supporting that helpful?
Yes.
Oh.
He's on the other side.
It feels so good. I need somebody to do that every day.
So now we're going to have to find our way all the way to the other side of the table. And that's where I'll show you one of the greatest people pleasers I have. So we're going to be doing this almost a mirror action. Just get your hand right on their upper trap area. So when I walk around, like I worked on this arm. So I come around, making contact. See, now that's a way to not break contact. This is over the sheet. And here's just grabbing onto that upper shoulder area. What you don't want to do is have your fingers curling over in such a way where you're gonna. So you gotta stay a bit more posterior. See, this right now would be too much. So I have to set my sloth claw a bit more like this. Not here, but like this. Now, and then just bend both knees and let your tuchus get the pressure. Just lean back.
Yep.
You can curl your fingers a little bit more as long as you're hot far enough back on the upper trap area. Anybody that's practiced a little bit with your thumbs, you're trying to make your fingers curl and pull the upper trap. This should feel fantastic.
good.
Everybody should love this. Now you hold it. You see it? Very good. Straight spines. Very good. And then have them take a breath. You know, you don't have to stay like that forever. Like, let yourself come back, sink back in, big nice pull. There's one where I'll even give myself a stretch. I'll be like, and then have them take a nice deep breath while you hold that. Hold their shoulder down. You're bringing their scapula into depression. Take a deep breath all the way out. Follow those ribs and their shoulder down as they exhale.
I've also done it where I will just use one arm
Mhm.
and I'll turn away and I
Oh,
get
yeah?
a pec stretch.
Nice. That's a good one, Sarah. Yeah.
Oh, yeah.
Another way to incorporate kind of a kneed action here for the torso. Because here it gets a bit awkward. I don't want to end up all armpity and stuff. Like I have to be a little bit cautious of how I knead here. It's more awkward to knead on these big flat areas than it is the limbs. But if we have a pull hand here, a push hand on their low back. So my right knee is forward. You want to flip your feet. There you go. Push hand, pull. Not perfect, but now don't apply a lot of stress here, but you can get a little bit of like a low back massage with like the upper trap circle work. So it's just like you can do a little bit of this push-pull action. And you're working on two areas that people usually want you to work on quite a bit. But then there's two ways of doing this. I can be like this, switch, here, here, here. Now I'm on the other side of the table to now balance them out and work on that side of the low back and get to the other arm. That's a way to get yourself all the way back around to then undrape and do it all over again. Get their arm out of the way. Identify their sacrum and their lumbar spine. Yep. Beautiful.
Yeah, that's good.
And then go ahead and just go with the motions. Put forearm into their low back. And try switching your forearm.
I was looking at it,
Yep, yep. Trying to mirror it is going to be interesting. And depending on how one side dominant you are, like my right arm is much more coordinated than my left, you'll be able to get there. So a couple compressions, changing your elbow angle. Just try to make it rhythmic, like you're kind of, and you should feel their body moving. I make my clients rock back and forth a little bit while I'm doing this. Then take a step up, closer to their head. Get onto the thoracic region, over their ribs. Do a few really good squishes there. And come up, stand right next to the head. Move their arm back out of the way off to the side of the table. Forearm between the scapula and the spine. Find a couple spots, one that's more upper trap, where your elbow angle is really increased. And then you can flatten it out as you work your way down the thoracic, spine, and the ribs. Then we're to the upper arm. But you just usually have to switch your feet, and whatever palm you were using, you can just, yep. You can go into some knead actions here. Just make sure your fingers aren't curling too much into the medial side of the upper arm.
What's that?
Come around and then stand in line with the humerus. Arm closer to their head, underneath the elbow. You don't have to do this forever, but it's just a nice option of like how to control them, because I can move their arm around like this, and then I can use a forearm, work on the triceps. Smaller people, I don't use my forearms as much on their arms, but you get somebody bigger then. Then, arm up on the table. And then here, just practice your kneading actions. Arm closer to their elbow, good foot switch, I see it, you got it. You're going the right direction, you got it. More muscle is up at near the elbow. So that's where I tend to do most of my applications here. If you're feeling especially brave, you can kind of put both hands on the entire form, and you can do one curls over and supports. So right now it's going to be my left is pushing, my right is just kind of holding, maybe a little bit of a pull. But usually if you just hold an area still while you push, then a twist is occurring. And this thing right here. I'm just going to hold this still and push. And the twist, the torsion, stress will occur. And then I just switch my feet. I let my fingers curl around the tissue closer to the elbow. I switch and then do the same thing, but now it's gonna be the palm that's closer to the wrist. That's where I can do kind of a foot swap thing. Then soft fist on the hand, supporting that thumb. As long as you have that thumb supported, you'd be pretty surprised at how much pressure the palms usually want.
How's that? Good, you could probably do more.
Yeah, you will be very surprised.
More?
Hands are quite durable. Yeah, you have that thumb supported.
Pressure. Do more pressure.
This is a safe place where I'm usually like, you'll be very surprised at how, starting out, you're gonna be worried you're gonna hurt somebody.
Yeah.
But this is a place to kind of indicate you think this is a fragile thing, right?
Mm-hmm.
Right, you can apply plenty of compression.
It's hard to get restless.
Yeah, support the thumb and squash away. Yeah, we're moving at a slower pace than would usually be a good massage, right? Then we're done. Arms can go wherever they're comfy. We redrape, we're all done. Then we gotta swoop around and balance their shoulders out. So swoop around, do that pull, balance that upper trap area out.
I'll be fast.
Oh, quick potty break.
Yeah.
Which hand is
I'll be
the
quick.
bottom hand then?
It's not, there isn't really a right or wrong. For me, it tends to be I'm reaching across onto their left shoulder, my right hand is the bottom hand. If I swoop around, I'm on their right side, my left hand is their bottom. But really feel for yourself, there is not a wrong one here. You find and feel what is more comfortable for you. Okay, so now we're standing at their low back, near the hips and the pelvis. I'm gonna wait just for a moment while she gets back. That's where it's important, having the robe and slippers in the room. So bathroom baits with the me jabbering away. Usually about halfway through is where you do want to do a verbal check-in with people. Kind of just check in, like usually that's about at least like halfway through the second sideline position. But you should do kind of, you need a potty break, stuff like that.
Pulling on a different
I was pulling quite a bit.
You put
Was
one
it
of
okay?
those back in, yeah.
Okay.
I felt
Good.
very wet.
Yeah, so
Feel the thing?
playing with this idea,
Yeah, I'm
Asking
not, I'm
other people
like the more,
is
the
how much
better
you curl your fingers.
You promote.
I mean,
Okay,
you want to be
but
here,
not pulling on your neck.
No.
but this will feel different than this. This will feel different than this. It's very subtle. You see me taking these small steps. They're tiny crescent actions, but really it's creating a stress where this is gonna pull scapula more down this way. It's gonna feel more like an upper trap scapula related thing. If I do this, it's gonna feel more like it's about the neck. Then I can just do these actions and make that feel like a really good massage. And then you can curl your fingers a bit more to be more targeted. Somebody wants more pressure or more intensity on the spot.
You feel the difference?
Yeah.
It'll look like you're just doing the same motion again and again. You make these tiny little
One
step
feels like it's in the
adjustments.
shoulder.
It's like if the hand and the chin.
Okay.
You're squashing away using the same soft fist.
Both.
You're just doing it like this.
Pressure at different points.
Exactly. And it makes it feel better because it's doing it.
So we should be feeling that whole scapular region kind of moving.
Yes. We could get to the point, we'll get to an assessment thing where you can just grab onto that and start rolling it around and everything. This is more of a people pleaser for that area that they always want worked on. But yeah, there's a point where you could be grabbing all that scapula and really rolling it around. I'll show a version of that once we get, because I'm trying to speed us to sideline. Now we're going to be getting to the appendage. We already worked on the appendages, the upper arm, the arm. Now we're going to work on the leg, the hip and the leg. We want to undrape just to the knee. That's all we need access to. Anytime we're doing joint movement, we want to try to visualize the bones and the joint that's being moved. It's the knee. I want my hand supporting and causing the actual movement to be at the distal end, the far end. Distal means further away, proximal means closer to. So the distal end would be like I'm at the ankle joint. That's the distal end of the tibia and the fibula, which come and make up half of the knee joint. So I want to hold here to move the joint. I don't want to hold here to move the joint. And that's just for good leverage. Also, you're protecting the ankle, because if I did this, then their foot could be wobbling around, right? So for mechanics, even if I was going to move the hip joint, I would grab here near the knee on the humerus, and I would do this. This would be a harder action because we're fighting gravity, right? But if I were to get closer, one, I might be like too high up and everything, but it'll be a lot harder to lift here than at the knee. And this is very basic physics-y things. So we're always going to be holding at the ankle, is all it comes down to. Now, although we're holding here and we have bent the knee, we're doing hip rotation movements. That's external rotation. I know what the foot going on the inside is tough, but external rotation of the hip, internal rotation of the hip.
Do you like more of a stretch or less?
Flexion of the knee, extension of the knee. Flexion. Now, can we make this dance a bit more pretty? Like when I first drape, I undrape, kind of just slowly take the knee to flexion, slowly take it to extension. We make it feel like, you know, one of those like really slow motion dance things you see, some kind of art house theater. Just slow, like slow motion dance. I don't have a better analogy in my head right now. Now we're here for the hip. I'm going to rest my hand ideally on the sacrum. This way I'm stabilizing the pelvis, and when I do this motion, when I'll know when I've hit end range is either when I feel the leg stop or when I feel the pelvis start to move. Because if I start to move the hip and this turns underneath me, I know that now the hip has stopped moving and the pelvis is moving instead. So go ahead and just rest your hand on the sacrum, let the hip go into external rotation, and find the end point. And then come back the other way. And how symmetrical are they? Ideally, it's about 45 and 45. Typically, people have more of this, more of external, and less of internal. Cool. Now try, well, it'll get easier time. Now it would be like an important part, especially for low back dysfunction, to assess one side to the other and see how both of their hips are in this situation. All right. Now, based on where our where the sacrum is, we can approximate where the greater trochanter is. That's finding that big bony projection for the hip joint. You will get to where it's just easier and easier to find. Like usually for me, it's about a full hand breadth. So I start to just be able to visualize it. You may find that just having your hands sit on the lateral portion of the leg, like their IT band, roll it back and forth in that nice flowy dance, work your hand up until you find that greater trochanter. You're on the lateral side of the body, it's not very invasive, it'd be over the sheet. That way you clarify where that hip joint is. The greater trochanter is one of the most valuable bony landmarks you'll have. Let me come around so you can see this better. Now once I find that, here, I know that's where I want my forearm placement to be. Not up here on the pelvis. I gotta make sure my elbow contact starts about there. I want it to be I want my elbow to not be above the line of the pelvis. That's the iliac crest. That's why I'm finding the sacrum, greater trochanter, right in between. Then as you do this motion, you might feel with the underside of your forearm that trochanter roll. If you take the arm this way, if you take the leg this way, that greater trochanter will roll up into you. If you take it this way, it'll roll away from you. And you'll have more space. And it should feel a bit more comfortable. What's cool is as we work more on these structures, that would be the way to create a stretch here. So typically in this setup, I'm here, go back and forth, but I'll go here and kind of have the leg do a little bit more of this internal rotation, which is usually what they need anyway. Now there's a few spots, so let's try, we have this one, try going a little bit lower, just a couple inches down, where you should feel like you're closer to that greater trochanter. You don't want to be on it, so person on the table, make sure you're shouting loud enough.
You're good.
Yeah, we're good.
In this orientation, we're technically wanting to be just posterior to it, but it's going to feel like you're above it. You want to be above it, but since they're laying down, it's posterior. You got your big glute muscle here, gluteus maximus, but then right here are all the little ones. The most famous one is piriformis, so related to sciatica, a lot of stuff. So right here, back and forth, one step down, real small, back and forth. Doesn't have to be big. Now, we're going to, instead of thinking about the legs in prone, we're going to work on them in sideline. So here we would redrape, make contact with the knees, heels, soup all the way around, and balance their hips out. I also am doing this so you're getting a more immediate compare and contrast. Kind of try to remember what their hip did on one side.
This is my dick.
Oh, okay.
That's the silly hip.
Yeah.
Yep. So then, yeah, do a compare and contrast a bit. It's okay if you don't fully remember. See how their knee moves? And then move, hip back and forth. Very good. Excellent. Excellent. And once you've found the bony landmarks, you can figure out where your forearm placement should be. And apply the forearm. One spot, higher up, thinking gluteus maximus. Do a few motions. You want to hold this compression for a while. And like, yeah, nice slow hip motions back and forth. And then little step down. You're just moving your forearm a couple inches to then be a little bit closer to the greater trochanter. The group of muscles there are called the deep lateral hip rotators.
How's that? Good.
What's that?
So that's like where
Is
they're
there
all,
enough pressure?
is like
Yeah.
tight there, where your elbow is.
Where my elbow is?
And especially for those on the table, just feel also like how the rotation changes the nature of the sensation, makes it feel like more massage. And also about whether or not you would want more or less pressure. I would guess that sometimes it can be a sensitive area if you have low back or hip things. But oftentimes people want a lot of pressure. So, all right. Go ahead and reset once you balance them out. And now we're going to go to sideline.
We have more
Get
internal
the foot.
rotation on this side.
Feet lifted.
Yeah, more internal rotation.
That's crazy.
Now, this is the biggest moment of your drinking life. If you do it wrong here, then you have to I'll fail you and that's that.
You have to move. Leave the country.
All right, what you want, that was pretty good. Get that sheet up over their shoulders,
Wait, you're on that side, okay.
okay? Make sure, so you're gonna wanna have that scooted up higher over her shoulders. You want this to have some good coverage.
Okay.
And once you're here, make sure you're not lifting too much. You wanna be holding it about there, nice and taut.
Okay.
That's just, now, in a clinical room, it's not nearly as much of a thing,
Ready?
but in these spaces, we have to be
This way, this
aware
way, do you care?
of how much we're lifting. Because if I lift so much that I'm like this, I genuinely as a practitioner can't see something, but you can, right?
Okay,
So,
Am I coming towards you or away from you?
yep,
This one, does it go underneath the?
yes, always, yep, yep. Can even be underneath,
If you
I,
have a pillowcase on it, you don't have to worry about it.
if you long you're changing the pillowcase every single time.
Right.
Yep.
Okay.
You could also put it underneath the fitted sheet.
Okay.
All right. And here's a couple things. When a person turns on their side, if we leave that pillow here, this gives you a better example of they have to scoot down where their head is not on the table. We can use the face cradle or not. In this case, I'm just gonna move it right out of my way.
I will do this way so you get the.
Yes, this is a lot of hypomobility in the spine, on the spine. But this is how that could create a nice pocket for that shoulder joint. You just leave that pillow in, when they scoot down, it puts it usually in the exact right place for the ribs. Then you're good there, here, and then yes, we always want this underneath the sheets. I go right in the bungee and put it underneath the fitted sheet.
Once you get them on their sides too, you wanna make sure that their back is more in line with this edge of the table. That way you're not
You need your
reaching.
glasses or what?
So just have them scoot back.
Yeah.
When I take my glasses off for a while, or when I use them, I get migraines without having them on, just because of the blurred vision.
Do you know what Boston is? Your contact?
Neither.
So Sarah brought up an essential point here that you don't want to get lost in just having a person lay on a table in a way that makes it difficult for you, right? So if they're laying really far that way, then you're going to be reaching the whole time. We're mostly going to be working on this side of the table with their back to us. So I need them to scoot down where their head is off that face cradle, and I need them to scoot back towards me a little bit. It's not too hard to make all these adjustments by just coaching them. Just to scoot a little bit towards you, scoot down a little bit more, and then once they're here, we're good. But you want to get good at that, because especially if they're a smaller person and they're all the way over there, now you've lost all the advantages of this.
Don't be afraid to tell your client to move.
Yeah. And you teach them. They learn. After they've gone through the routine, it's much easier. So they're set up like this, ideally. You really need this, because then that's what keeps the pelvis in line. Now, people will get all kinds of rolled over and ultimately want them comfortable. But at certain times, especially if we're working here, we need the spine in as close to neutral position as possible. So that's where this big bolster is so important. If I had that out of there, and then that hip is going to be so internally rotated, they're usually going to roll in at the pelvis, and the lumbar spine is twisted. That puts the lumbar spine in a more stressed position. If it's not uncomfortable, it at the very least makes it where if an injury could happen here, it's more likely. Same thing with the pillow here. Always put the pillow under their head. If you don't, you're putting that spine closer to end range, and if you work here, this is where people get scared. But as long as you bolster and keep the spine relatively neutral, as close to neutral as possible, you're really safe. So always bolster. Pillow, bolster. The most important one here is to always use the pillow for their neck and their shoulder. Otherwise, they're just all kinds of scrunched up. Okay? Let me get this set. Yeah. Now we get to do something nice. get to start the routine. Now, anytime we work at the head and face, this is where you want to kind of, in an exaggerated fashion, sanitize. You should be able to smell it. But you're going with your head. That's okay. For you and them, I'm not a person that's usually worried about this, but here's the thing. You've touched like other areas of the body and everything. I know. I'm sorry.
Oh, it's so bad.
So, so always sanitize as you come up to their head. So now here's where we can just do some nice things. You want that out of the way. You know, just pull right at you. Yep. I can set it to the side or anywhere. Yeah. And then this is where we get to start. What's nice about the setup in this routine, so in prone position, we start in the low back, we end at the feet, right? So we're gonna kind of try to start and end in ways so that regardless of how a client were to start, you would have a good place that kind of fits in like a massage routine and ends. It starts at a good place and ends at a good place. So here we're gonna start at the head, end at the feet, and then flip it. And then it wouldn't matter. Let's say a client just decided they wanted to lay on their sides to start. Then you could do side, side. You start in the same place, you end at the same place, and then you do supine prone. You mix it up, but you don't change the position routine. That way you're locked in, and you don't have to be thinking about it. All right, now here, look at this fun skull. The temples, the scalp doesn't have a muscle. The main muscles that kind of control the tension of the scalp are here on the front, just above your eyebrows, called frontalis. And then on the reverse side, on the occipital bone called the occipitals. It'll be called occipitofrontalis. Two muscles on either side that basically use your scalp as a shared tendon. Right? So, eye strain stuff, anything here, how that can kind of eventually cause it feeling like you got too small a hat. Fine. So if I can put my hands on, just above and on their forehead, one hand on the back of the head, and give the head a nice squish. It's that counter pressure thing. It's the same as the knead action, but no slip. So squishing the top of the forehead, squishing the back of the head.
Okay.
Then there's the flip, or if I come around more right in line with the skull. If I wanted to work on the temples, maybe I have to stand a bit more at an angle. You got that cheekbone to watch out for. Right here, I don't want my fingers to be in their face. So I make sure my fingers are directed towards the back of their head. And then one hand right on the temples, other hand supporting the back of their head. You want to be, yeah, you go, yep. You had your first orientation right. Yep, there you go. Left hand, push hand. And same thing, just push, pull. We'll get more nuanced with this, but these two kind of starting orientations, see how I can swap from one to the other? Push, pull. Push, pull.
This is so
Push, pull.
confusing.
I know.
I can't.
Once we find it.
It's
Yep.
firm. Okay.
Yeah. Oh yeah, sorry.
Like this.
Push,
Okay.
pull.
Oh, okay. Yeah.
Pushing.
Yep.
Push with that.
You really can't do it too wrong. Esthetician will let you know. It's hard to do it wrong.
It
But
really is, like, yeah, as long as you're like,
approximately.
yeah, people don't care.
Oh, God.
Don't poke anything super soft too
Yeah,
hard.
don't rip the hair out
Yeah.
and you're okay. But a good head squish is an amazing thing. Okay? Tension headaches, migraines, even if you can't actually change the vascular nature of the migraine is causing added muscle tension of the muscles of the skull and the face. So loosening these up can be essential. TMJ. Everybody thinks about masseter as this important muscle for TMJ. The temples are involved with jaw action. So just being real thorough and squashing this around, and you can't really do it wrong. You're good to go. Okay, I lost. Client's in a bad orientation.
Yeah.
God. Yeah, and get that feedback. Like, which one of these felt better? Feels better to you, client? Okay. The temples.
Yeah, they didn't.
If anybody has somebody, TMJ, this is a place where you want to start. Like, we can target work on the temples, anything like that will help with jaw stuff. Might not be perfect, but it's a factor in it. Okay. Now we're going to be working on the neck area, which is what scares people usually the most. All right. Now, to start with, if I have my client laying on the left side, so my left hand could rest, just supporting the head. I'm not pushing down. I'm just keep knowing where the skull is. The other hand's going to come over, make contact with the neck. And then just let yourself make contact and become acquainted with the cervical area. I'm not trying to turn this into a massage technique moment, but just you have to work on the neck for the first time somehow, right? See if you can find the spinous processes of the spine. You're going to be able to find them lower down. If you come down to where the neck ends, you're going to feel a really big one. Really big one. Then trace that up, and they're going to just disappear. Okay? The base of the skull is very deep in terms of a concavity. It's an important point of reference. You'll always feel C7. C7 is a big projection. And you'll work your way up and see how they just get smaller until we're to one that doesn't even have a spinous process. But that's all, if you look at me, this is all filled in with muscle. It's a very thick area of muscle. So we're going to become acquainted with it, and again, this is a little bit for my sanity, everybody's sanity, that I don't worry too much about putting you through all the emotions of working on the neck right now. But eventually, the essential nature of using a forearm here is the most amazing thing for neck and headache-related issues that I will ever be able to show you. Starting out though, we palpated this way. This would also be the way, sorry for my digression there. Standing here, soft fist, right into the upper trap spot. And then just rock back and forth. Now you want to be standing a little bit posterior, a little bit behind their ear. Don't line yourself up where you could end up more like.
I feel like it's like closer to the neck.
If you want to make sure, except for a little bit further. Maybe I'll keep you back here.
Just make sure everything's kind of.
It's a bit posterior. That looks really good.
I would do this.
Very good. You want to be a bit posterior. Yeah, we're doing great. Now try, instead of the soft fist,
Then you just want your wrist.
a forearm. But stay posterior. Stay. See how I'm standing a little bit behind their head?
So it'll be here.
You're gonna switch your feet out of the step.
It's not so much.
With this, with the forearm, you might not need it.
There you go.
There
you go.
Or elbow. Pressure. Good. You're gonna switch your feet. There you go.
feel like this hand is very oddly placed.
You will, and even get a little more here,
Yeah.
and then that's just gonna relax.
You want to stay
this
close
muscle
to the
right
neck. Don't keep creeping up to the shoulder joint. You'll end up just on the acromion. You'll just end up on the scapula. All right. Now, go ahead and give that a pause. Here's a place that'll feel less anxiety inducing, I promise. Because here now we can just come around, palm, right to the base of the skull. Just support their shoulder. What you are actually feeling is the scapula. You're going to be holding on to the acromion. You're going to be really holding the shoulder, just so you know where it's at. And then, yeah, let your palm make contact with the skin on the neck, and just work your way right up to the base of the skull. It's a crowd pleaser. It should feel comfortable for you. Now you'd be amazed, even right up on the base of the skull, the occipital bone, you're going to apply pressure. There are those muscles there. You can be pretty thorough here. This orientation of having your hand behind the ear, you're very safe back here. I will get you to stop doing this with your hand and do it with the forearm, mostly instead. But this is a good starting point. Okay? Now, we'll have a bit more focus on like really getting the arms set. Usually, what I do is, as long as I stand down here and ask a client to please bring their arm out and on top of the sheet, then we're safe. We have to be a little bit careful here where we may have to ask the client to hold the sheet with their bottom hand against their chest. This is not turned right. There we go. But they could, there we go. There we go. They could hold the sheet with the bottom hand and then bring their arm out for us, okay? Then we're here. We want their arm out and on their side. For any additional concerns. And okay. Good luck with your trick or treat.
Thanks.
This is my hack. We don't have towels, so since we're not draping, but this is my biggest one here, that we're gonna go like this. And then everything's good and secure. Now, what this will allow for, though, is now we can do that scapular shoulder movement stuff. Have your one hand go underneath. The other hand can rest right on their scapulas, and then just roll that scapula around. The arm's going to move with you, but we're doing scapular movements. So we can either kind of pull down and kind of, yeah, the leg moving on me.
Yeah.
Or you can pull here, where even it feels like we're kind of lifting their head up off the pillow, creating a little bit of a stretch. You can just kind of roll that scapula around in lots of nice ways. This will lead to being able to maneuver using the arm, like moving the arm and supporting the arm and working here. But this is a complex area to navigate because of all the bones in the way. But this at least gets you to a nice place for like this shoulder movement. And if you place your palm in different areas around the scapula, like a little bit below it, so it feels like you're kind of pushing it up and then pulling it back down, you can make this really feel good. And it's doing great mobility stuff for the scapula mostly, but we can make it a little bit more about the shoulder joint. And then eventually we can really make it about the shoulder joint. This is where I have the most range of motion capabilities with the shoulder, because otherwise it's trapped against the table and prone and supine. So for neck and shoulder, side lying is actually the most important position, because then you can get better access and more mobility here. Okay, next spot is we're finding the ribs. Arm can go wherever it's comfortable, but getting them where the arm is just internally rotated across the front. We want to find where the ribs end and where the pelvis begins. It's usually a pretty narrow spot here. Now, there's a lot of important structures here relative to the low back. You can work on the low back much better here than in prone. Going this way will do what? I will smash into ribs.
Yes.
So stand this way, where your arm and your direction of force is towards the pelvis. Hard to miss, you'll bump into the top of the ilium and then just sink real slow, straight down, like you're cutting them in half, like a magician.
Does that feel okay?
Yeah.
Right.
If you go the other way, you will hit the ribs. So please believe me. There may be demonstration videos via my mother showing options like this, but I strongly, strongly recommend that you keep this one in mind. You can get almost everything that's essential about the low back in this orientation. And for people that have issues with low back, laying prone is usually uncomfortable. And a more extreme example would be if somebody has spinal fusion. This direction of force does not put stress on the spine that takes it into flexion extension. Like somebody's laying on their stomach and prone, and I push. See how that's going to move it? Doing this, I'm not applying a whole lot of stress to the spine. So even with cases like bad herniations and spinal fusion, this is quite safe.
So with a new client, are you generally asking if they've had any surgeries?
Oh yeah, they need a whole injury clearance. Yeah, that's all
Yeah, I
in
know
the
it's on the
paperwork.
sheet and everything that we did.
Yeah, but I still verbally make
still
sure.
verbally
Oh
ask
yeah,
them.
it's like anything. You find a scar, you're like, what's that?
Oh, yeah, then they're like, ah.
Oh, it's like, oh yeah, I had this traumatic thing.
Yeah.
Yeah, it's your corpus form.
Whatever that is, yeah.
No. Yep, Keywell, the most popular. Now also here, we can palpate the top of the ilium, find the greater trochanter. Really hard to miss here. Now between the two are all muscles. This may not be the option that you pick because you'll see that your body mechanics are a little bit more limited here. So hydraulic table, I would lower it, or I would get on the step stool to give me a little bit of height to come down on that spot. But usually I can work on these areas okay in prone and supine. However, for more specific hip issues, this may be the better option. So we'll come around to showing how I could work on all these hip-related muscles in this orientation. That could be here, here. I just chase that greater trochanter. I just walk all the way around it like a horseshoe shape. All right. Now we're standing here.
QL.
Quadratus lumborum. Lateral hip flexor that's also involved attaches onto your lower rib, your floating rib, so it can get screwy with breathing and everything. So usually what I have people do just is the nice thing. You hold the compression, big deep breaths.
That's what she was doing.
Yep, she's already doing it, but then you'll feel that really change shape. Okay, now we're to the leg, and this is where we're going to have by far the best application for the hamstrings, especially the higher hamstrings that would be related to hip and low back issues. What we want to be mindful of is where our hands are related to the medial thigh and coming up near the pelvis, the medial pelvis, right? So my orientation with my hand is going to be not this, but this. I'm going to let my forearm, my shoulder be internally rotated. That way when I come in and apply forces here, my elbow is going to be what's making contact closest to the pelvis, and my hand's going to be down and out of the way. And that hand can rest on the bolster, it can rest on the leg, and then it can kind of pivot. Now, if we increase our elbow angle so that we're more on the, if we were prone to be on the lateral side of the body, but in this situation, because of how they're laying, if I increase my angle and I'm like this, I'm going to be more smack dab in the middle of the hamstrings. So this angle over there will be on the hamstrings. If I flatten it out, or I flatten my arm out and I go more on top-ish, I'm going to be on the medial leg, I'm on a different set of muscles called the adductors. So So the applications here will look like this. It'll be sharp elbow angle, then flattening it out. You work your way just from high to low. Start closer to the hip joint and work your way down to the knee. And I tend to do, that's my routine, but you could do one and the other. But it's a way to work on what is the posterior side of the tissue, the hamstrings, and then the medial chunk of tissue, the adductors. This is really the only efficient position to get all those. Really good. Let's keep on scooting our way through. We're gonna try to get us just to stop at 12:30. So now we're to the lower leg. Just switch which forearm you're using. Stand right at the knee. Stand right at the knee. I was working on their left leg. I was using my left forearm. Now I'm just gonna switch and use my right. I can do the same thing. Sharp elbow angle, but then I'm right smack dab in the middle of their calf muscles. The biggest one is gastrocnemius. That's the one you can really see and feel. And then it turns into, it along with a couple others, become the Achilles tendon. They're smack dab right on the posterior side of the lower leg. Anybody that usually has very sensitive calves, this should feel nicer than when people work on your calves in prone. This should feel much more gentle actually and more effective because it just centralizes the therapist's application more right smack dab in the middle of them along the medial line rather than being stuck more out on the lateral side of it. Work your way down. Once you're more than halfway down closer to the ankle, it gets more tendony, so you can just lighten it up and then your orientation is great. Then once I'm down here, I switch and I could do a forearm, but if they're smaller, I may just use my palm or soft fist. With a palm, you can apply forces like this, where I feel like I'm gripping the muscles and kind of pulling them away from the bone. So for you, it would be like that. Make sure your wrist and your elbow are comfortable as you do this. But it should feel like you're kind of just grabbing hold of that tissue and pulling it away from the tibia. That or a soft fist. I just put my one hand right on the arch of their foot, soft fist, really close to the ankle, and then I can glide right up. That'll usually have a little bit more intensity to it, but it works really good and it is better for your wrist. All right, now the best part. I have a left foot in my hand with my left hand. So whatever you want, your same side hand to their foot underneath it, kind of cradling the lateral side of the foot. Yeah, very good. So let it be more on the metatarsals, so where just the toes are peeking out.
So right foot, right hand is under.
And that's wrong. I'm very sorry.
I was like, that felt very weird there.
Their toes should be making contact with your wrist. I'm sorry. So flip it. It's my right hand on their left foot. Much better. All right. Not dyslexic. But here we go. You see how I can be cradling the whole top of their foot?
Yes.
Protecting their toes and everything? This came from working with a lot of jammed, like turf toe. So that when I worked on the foot, I didn't want to inadvertently be moving the toes too much. I wanted there to be a buffer. So I used my hand as this buffer. But I ended up creating this nice sandwich effect where like we're making contact with the top of the foot, and then soft fist is one option. The only thing you need to watch out for here, you usually would have to smash really hard, but the directly into the calcaneus is not going to be comfortable. There's just a fat pad of like extra tissue and then goes right to bone, okay? Underneath of it is where everything starts. So we don't want to be pushing too much straight down into the calcaneus or the heel. Don't be mashing there. And then what people call the ball of the foot. It should feel like where the big toe just ends. So that's the first phalange and the first metatarsal. that portion of that big toe joint, the first metatarsal, has these extra knobs where some tendons come through. Those you don't want to push on. It'll just be mashing bone and tendon, right? Everywhere else though, even the rest of like the other metatarsals, is pretty much fair game. So I just cradle this, and then you'll feel it. Like if you were to go up into what we call the ball of the foot near that big toe, you'll feel that bony like part. It would feel like you wouldn't want to push into that. Everywhere else you're good to go. All through the arch of the foot, and then the forearm is going to be the big one. You can use your soft fist like this, like this, like this, like this. But try cradling that foot, and then it's gonna fit like right in a pocket. Bring that forearm over. And you really can't. That'd be close to pressure good.
Oh, yeah, that's good.
Now, this is where you can check in with people, see how much pressure they actually like. The feet are not as delicate as you might imagine.
How's this pressure?
All right.
Anybody want
That's
more? Anybody want more?
More pressure?
I think, yeah, a little bit more.
More pressure?
Don't hurt yourself though.
Yeah, no hurting yourself as a therapist, but try just so that I'm chipping away at the mold of like the concern of, we'll get to bringing scales out and looking at pressure, like pounds and stuff like that.
I already did that.
Mm-hmm.
Oh, you did?
Yep.
Thank you, Sarah. All right, that's one side of the foot really good. Now let's come up over onto the other one. Now undrape. Here's where inside line there can be a cautionary moment with bringing the sheet higher up, because this is where inadvertent windows can be caused, okay? So what you want to do is make sure you really bunch the sheet up and it's hugging around their entire upper leg, and then you scoot that up towards their hips. That way there isn't a draft. No draft. But that's all it takes. Really bunch it around the leg, then move it up. You're totally good to go. Now, here, I find this is going to be a little bit of like a personal preference as to how comfortable you as the therapist find working on the upper portion of the leg here, okay? Where the table gets in my way. And people that want aggressive IT band work though, this is a good option, and it's okay. I just tend to work on this part of the leg and this part of the leg more in prone and supine when I can, okay? You have to know how to do this in the event that somebody can only lay in sideline. So it's not too hard, you just support the knee with one hand and the other arm comes over with the forearm. You don't want to be too directly on the IT band unless that's what they really, really, really want. Okay? You're not going to probably cause permanent damage, but the IT band is just dense, deep fascia. We usually need to work on the muscles along the line of IT band. It's a little bit different. We can work on the line between the IT band and the hamstrings. It's just a little goofy because the table's bumping into you and all of that. It's not too bad.
This is just the only where I feel like I would need to lower the table a little bit.
Mm-hmm. And that's part of why in my routine, if I have access to prone and supine, I skip this. I save working on that area of the body for those positions, but I work here. So I swoop around and I go just to this, to the lower leg. But we have to practice that. So you want to get good at it. And if you're good at it and you're comfy, then awesome. Now here's one of my absolute favorites, and it's a really under-addressed area for the knee, but especially for the ankle and feet. This is a really important area. The medial portion of the tibia, there's nothing there. It's all lateral. It all sits just lateral to the tibia or right on top of the fibula. So in this position, the way the leg is oriented, you have perfect access to it But in supine, it's difficult to work on because it's all off to the side. So right here is gonna always be the best option for this. Not just athletes, anybody needs their ankles and toes to work better. And this is the other half of everything on the other side that people don't think about. All right? So what's cool here? Just grab their foot. Who doesn't want more foot massage? And then forearm. And there you go. You can't go wrong. Closer to the knee and just work your way.
How's this?
Let your elbow angle be a little more. Yeah, this is one of those classic,
Yeah.
I got tight hamstrings, I've got tight Achilles, and they don't think about all the stuff over here. It's really important. There's two compartments of muscles that people, the one you'll hear is shin splints, but boy, can you do good work here.
Yeah.
Now, here's my best and favorite ever kneading place. One palm, you'll kind of find the tibia. So if you feel underneath, you'll find the tibia, and then there's a real hard ridge. You want your palm to be just lateral to that, or kind of on top of it. Your pull hand can go all the way over, be grabbing onto all the calf muscle you can get a hold of. Right? You can get a really good handle here is the cool part. And then just sandwich for days. When you're doing this application, you're essentially distorting all the muscles of the lower leg all at once. And you can just, you can give that a really good squish because you're not pushing these right into the skeleton. You're creating more of a torsion pattern and pulling things away from each other, especially away from the underlying bone. You do this, to me, it feels wonderful, but it also just does a ton. So
Right there.
push,
This is
pull, torsion.
and not like a.
What causes a torsion stress, and the thing is when we do kneading actions, you probably are getting some combined stresses. So shear is going to be more on forcing one thing off of another. So when I talk about moving things off the bone,
Standing.
that is a bit more of a shear. A shear stress, the way when we massage is going to be more like this.
Okay.
If I grab the metatarsals and slide them back and forth. Usually kneading does more torsion stress, but there's actually combined stresses happening at once. Because when I compress, there's a bit of a compression stress. And then as I apply force, there's gonna be a bit of a bend. With the pull action, then we get a torsion as well. But there's more torsion with the knead. There's more lengthening or tension with a glide. There's more compression or a bend with a compression. So, yeah, but your head's using the terminology.
Yeah, I'm trying to figure
Very
out.
good. Now here, you can, as a kneading, as the steps to take for doing kneading and having it feel more fluid for you, you can just have your push and pull hands be the same, where it's push, pull, push, pull, push, pull, push, pull. Then switch. Push, pull, push, pull, push, pull. You don't have to do the fancy two-step. If it feels comfortable for you, then sure, you can, but both are totally great. They do the same thing, they balance it out, and there you go. Now, another crowd favorite. I have my hands correct this time, I promise. My right hand is underneath their right foot, like this, so that my fingers can curl into their arch. So it'd be your left hand. Be your left hand, yep. Now, I can keep this more gentle, where my fingers are like this, or I could give them more of a hook. Top hand goes across the top of the foot, and now I can push their foot into my fingers.
How does that feel?
For point work here, for those who are feeling more brave, like if anybody's had like an aggressive reflexology thing, or maybe like during a pedicure, they work like with their thumbs pretty aggressively. point-based. Rather than using your thumbs, this is a way to have a really targeted application, but it will be relatively intense. If you just flatten your fingers out, it's gonna be more gentle. But if you curl them over, you can work really targeted on the structures of the arch of the foot, but then you're not using your finger strength, you're just holding it still while pushing their foot down into your fingers to create that effect.
How does that feel?
Once you get confident with it, this ends up being the best foot massage I can think of, because you can just really give, I mean, you're working on all sides of it, right? You're giving the whole foot a hug. As if you change your hand placements where you're a little bit closer to the toes, you're trying to visualize these long bones. The foot and the hand are crazy things, where you got all these small
A
bones,
little bit more.
then all these long bones, then the digits that you can actually get up, or you actually think of as the toes. But if I bring my placement further up, it's really important that those metatarsals, those long bones inside of the foot, are able to slip and slide. So those are ones where I actually will kind of grip more like this and give them a bit of a back and forth shear.
That feels so
Effect.
good.
Right.
Totally does.
But you combine these actions and now you haven't used your thumbs at all, right?
Yeah.
I can do this, here, here, give it a wobble back and forth. You can focus that, where it can be where I tend to focus more on the fifth and first, like the pinky toe and the big toe. So big toes or your thumbs are your first, they're number 1, second, third, fourth, fifth. That's how it's numbered. For metatarsals, metacarpals, for the phalanges. I can target, then I'll go a step further in and I'm thinking the second and fourth. And then the third is certainly getting a lot of movement as we do that. And then we're done.